Did you know that in Chicago, nearly 50% of the COVID-19 cases and almost 70% of the COVID-19 deaths occur amongst African American individuals, and they only represent 30% of the population? What about Louisiana? Had you heard that 70% of the COVID-19 deaths occur amongst African Americans, and they also only represent 30% of the population? What about Michigan? Had you heard that 30% of the COVID cases and 40% of the COVID deaths occur amongst African American individuals, and they only represent 14% of the population? What about New York? Certainly, New York is the epicenter of all things COVID-19. Well, their data shows the same. It's a disproportionate burden of illness amongst minorities, especially African Americans and Hispanics. They account for a large number of the COVID-19 deaths. So your next question may be, why is this? Well, let me explain. First, let's discuss health disparities. What are health disparities? Health disparities are the preventable differences in the burdens of disease, injury, violence, the opportunity to achieve optimal health that are experienced by socially disadvantaged populations. How are health disparities and the coronavirus related? Well, researchers have emphasized that older age, the male gender, and underlying health conditions such as hypertension, diabetes, obesity, and heart disease are associated with high risk factors for worse health outcomes for COVID-19 patients. In addition to those risk factors, early data is also revealing that a higher prevalence and infection and death rates are amongst African Americans and other underserved communities. We should all be reminded that the most effective strategy to reduce the risk for COVID-19 is social distancing. I want everybody to understand that the opportunity to work from home, to telecommute, to even accept a temporary furlough should be seen as and valued as a privilege. There are many less fortunate that don't have those situations, and they have to go out. They're essential workers, and their jobs put them in harm's way. Let's all do our part to prevent health disparities by staying home and staying safe. Thank you.